All right, Dr. Raja, so here's the actual figure, 786,468. That's how many Americans on average get COVID each and every day. It's a pretty astonishing number, and it underscores just how contagious this Omicron variant is. So how's it impacting your staffing levels at MGH?
Ben, it's definitely impacting us. That number is more than twice what it was just two weeks ago, actually. I want to say years, but it was just 2 weeks. We've got about 260 patients in the hospital right now at MGH who have COVID, and we need every one of our healthcare workers to be able to come to work. Unfortunately, a few people are testing positive, and a lot of people are getting exposed and needing to go home and get tested. Fortunately, for the people who are getting COVID in my department, they're coming back and recovering well. Fortunately, because they got vaccinated and boosted.
So we know staffing is a challenge. Hospitals, they're busy. The weather's cold. The combination this weekend may make some people reluctant to come into the ER for COVID treatment, even when they really need it. So what are some of the symptoms that you would want people to head in right away? We know not for tests, but symptoms who really should be heading in.
That's exactly right, Erica. If you're having trouble breathing, if you're having chest pain, if you notice a family member getting confused or having trouble staying awake, they should come in. It might be a sign that they're not getting enough oxygen at all. But I want to make a little bit of a shameless plug, if you don't mind. The other people that we really need coming in right now, I know this seems off topic, are blood donors. Right now at Mass General, we have an unprecedented shortage of blood for patients who are really sick. And we have like half the number of donors than we did a few years ago. And the patients that we have are sicker and need more blood. So please don't just come in if you're sick. Come into a hospital, come into Mass General or a local hospital to donate blood if you can.
That's a good point and a good thing to remember. All right. Dr. Raja, we're hearing from some viewers who say that they've recovered from COVID, but they still get out of breath, especially when they work out, so they exert themselves. Have you heard that complaint before? And what can they do? How long will that last? Is there anything that can be done?
Ben, I have. And the fact is that we just don't know enough about the effects of COVID and especially how long they'll last. The concept of long COVID is real. 1 to 5 to 1 to 10 people are going to have symptoms that last for 1 to up to 3 or 4 months, and sometimes even longer. The key right now is if you still feel as though you're having symptoms, talk to your primary care clinician so you guys can work together as we learn more about long COVID to see what more tests can be done.
Okay, and before we let you go, one more viewer question if we can. Denise wants to know, will you feel safe entering an elevator if someone inside wasn't wearing a mask? So pretty specific, but you know, tight spaces is what Denise is getting at clearly.
Denise, that's a great question. Thanks, Erica. I thought she was just going to ask about elevators, and elevators are easy because there's been studies on this. There's been simulation studies that have shown that as long as people are masked, elevators are just fine, mostly because of the fact that you're not in them for that long. Right now, I've got to tell you, with a high quality and well-fitting mask, given that elevator rides are usually just a few seconds, I would feel safe with one other person in there not wearing a mask. I just would make sure you turn away, don't talk to them. But I personally would feel safe doing so.
Given what we're going through right now, I think it's an easy ask to say, please put your mask on. All right, Dr. Raja, thanks so much. Have a good weekend. Hopefully you get some rest.